Hi everyone, I'm Joanna, a certified nurse midwife from Mother to Mother Midwifery, and I'm going to be telling you about the supplies that we bring to your home for the birth. So on this side, I have tools that we use for the mom, and on this side I have tools that we use for the baby, and some of them overlap. So let's start here on the mom side first. Keep in mind that most of these tools we bring and we set them all up and we rarely have to use them. As opposed to like in a hospital, they're using these all the time. We're bringing them just in case of emergencies or when the need rises. But usually the process is really smooth and we barely have to use any of our tools. So the first one is IV fluids. And so if a mom is really dehydrated or vomiting a lot, or if we need to give IV medicine for any reason, we have IV set up, IV tubing, and there's to put in an IV. This is called an amnio hook. Sometimes there's a need to break the waters, which is something that's done a lot in hospitals, but we really reserve it for when there's an absolute need, and it's kind of a last resort. But we have the ability to do it if we need to. We bring sterile gloves for sterile procedures, so that's like checking the cervix, which also we only do if we really need to. We tend to not check the cervix a lot, so we can minimize the risk of infection. Alcohol pads, we bring iodine swabs. We keep everything sterile so that even though you're in your own home with your own flora, there's some places where we do have to be sterile, and we also don't want to be contaminating your space with our flora, so we try to keep that all contained. We keep everything clean. One of the things we could give IV is antibiotics, so this is ampicillin, and we can also give other antibiotics for GBS infection through the IV. We are routinely taking the mothers and the newborns, for that matter, vital signs, so this is one that overlaps, thermometer, blood pressure cuff. We're listening to the lungs and the heart with a stethoscope. There's mom's side and there's baby's little side. And some of you may have heard of sterile water papules, so that's something that we have. That's a technique of pain relief if you're having back labor, and that's what this is for. So sterile water injections for the back if you need it. Sometimes during the birth, moms can tear. It's something that happens commonly with first-time moms, and we're fully prepared to do stitches, and so that's one of the things where we would set up a sterile field to do. We carry different sizes of stitches depending on the tear, and then we also carry lidocaine to numb the area. You don't have to do that part all natural. That's going to go on baby's side. Another common postpartum emergency is called a postpartum hemorrhage, and for that we bring the standard medicines that are also carried in the hospital. So here's one here. It's called Pitocin or oxytocin. This is given as a shot or through the IV. We also carry Methergin, which is given as a shot, and we carry misoprostol, which is a pill that's given different types of ways. This is a urinary catheter. This is used, sometimes it's hard to tea when you're in labor or afterwards, so we can help with that if needed. A pulse oximeter for an adult, and there is also one that is carried for a baby, and I don't have it with me right here. Electrolytes for mom, very important to keep hydrated. That keeps the amniotic fluid high, it keeps the blood flow high in mom, and that all helps for a really healthy birth. This is called an ammonia inhalant. It's also more commonly known as a smelling salt, and that is in case of fainting. We also carry natural herbs, and so these are herbal tinctures. One of them, just a couple that we carry, this is called black cohosh, and this is called shepherd's purse, and they have various uses, and we really try to only carry the herbs that have good research behind them, and sometimes there might be a herb that midwives have used traditionally that really we have decided we don't carry, and so we're really cautious about using herbs and over-the-counter medicines and prescription medicines all in a safe way. Our goal is to first do no harm. So, and the baby side. Okay. So usually the number one thing people are concerned about for a baby is, what if the baby doesn't breathe when the baby comes out? Okay, so for that we have oxygen tank. Can you see it in the video?
Yeah.
Oxygen tubing. Okay, we carry 2 tanks actually. We carry a bag mask for baby for inflating the lungs. This is tubing for continuous positive airway pressure, CPAP, in case the baby needs more pressure in the lungs. This is called a laryngomask airway, and that's for doing an intubation if we need to get further down to have the baby breathe. And this is a Doppler. So you've probably seen these in prenatal visits, and this is really our main tool for making sure that baby's going to breathe when they come out, because if their heart rate is doing well during labor, then that means that they are well oxygenated in the uterus, and that most likely they're going to have no problem at all when they come out breathing. So we're keeping really, really close track of the heart rate. If it's going down, sometimes that can be normal if it's not going down too much or too frequently, but if it is going down too far, too much, or even going too high, can be a sign of infection or lack of oxygen, too much squeezing in the uterus. They might be squeezing their cord, and in that case we would go to the hospital so that we don't encounter complications when baby comes out. Sometimes if there's a lot of meconium where a baby poops in the water, that's very sticky and it can get stuck in their lungs too, even though the heart rate's really good. And if there's a lot of that, sometimes we go to the hospital for that reason as well. But just in case, if the water breaks at the last minute, there is something called a meconium aspirator, and that helps us get really deep in the lungs to get the meconium out. This should have been on the mom's side, but this is a mask airway for an adult. Saran wrap is also something that helps baby. So if we do need to do a resuscitation, it's really, really important to keep the baby warm. And so we actually, it sounds funny, but wrapping the baby in saran wrap, and we have a small heating pad set up as well. It keeps the baby warm. We also keep the cord attached to the mother if we have to resuscitate. That's very, very important, so that they're still getting blood flow from the mom before they've started to breathe on their own, get their own oxygen. So we would never cut that until they're fully breathing on their own. And the last emergency supply for a baby, this is called terbutaline. This is a medicine that if the heart rate is going too far down while the baby is still inside the uterus, and it's so usually when that happens, it starts to form a pattern, and it starts out very, very mild, and we do transfer to the hospital. If it is something that happens all of a sudden, which is a very, very, very rare emergency though, that's the medicine for that. So that was a lot about resuscitating a baby, but most of the time we do not have to do that, so I don't want to scare you. Most of the time baby comes out nice and normal. We let the baby breastfeed on the mom's chest for a good amount of time until they're breastfeeding well, and then we weigh the baby. So this is a little cradle we would put your baby in, hook it up to the scale, and we get a weight that way. We do a full head to toe examination of the baby. We'll measure the baby, check from head to toe, and if everything is good, we're able to give the newborn medications that are also given in the hospital. This is vitamin K. This is a vitamin K shot that we offer. Erythromycin antibiotic ointment for the baby's eyes that we offer. And eventually, if you want, we will cut the baby's cord. And we don't use the big, huge plastic clamps that kind of get in the baby's way and are uncomfortable. We use a soft kind of rubber band type thing to put around the baby's cord. If if the mom's blood type is Rh negative, you've probably heard that that's kind of a special blood type to have in pregnancy, and it's important to test the baby afterward. So we don't have to poke the baby, but we just take whatever blood is left over in the cord after it's all done pulsing and the placenta is out. We take it from there and we test that, and we'll also send it off to the lab. This is a home test, but the lab will have the definitive result, and we can give the RhoGAM shot if the mom requires that with the blood type. This is a glucometer. So occasionally babies will have low blood sugar after birth while they're still acclimating, and we can check it that way. The other supplies that are not pictured here mainly have to do with the water birth, and so please see our water birth video for the supplies that have to go with that.